Okay, so let's get right into it. We talk a lot about the huge challenges facing BC's healthcare system. But what if one of the biggest logjams has a solution that's, well, surprisingly simple and hiding in plain sight?
Everything really starts with this one huge number. 700,000. That's how many people in BC don't have a family doctor. That's not just a statistic, right? That means crowded ERs, delayed care, and a system that is just stretched to its absolute limit. It's a genuine crisis of access.
But what if the story here is a little more complicated than just, we need more doctors? What if there is a straightforward, common sense change that can make a real, immediate difference? That's the big question we're going to dig into.
To really understand the proposed solution, we have to reframe the problem. We're not just talking about a doctor shortage, we're talking about something called a healthcare bottleneck. It's a flaw in the system's design.
So what on earth is an administrative bottleneck? Well, it's pretty much what it sounds like. It's a point in the system where your care gets completely blocked by paperwork. A trained professional knows what you need, but because of the rules, they can't actually order it. So instead, you're forced to make a second, totally unnecessary appointment just to get a signature on a piece of paper. And here's a perfect example of how that plays out. Think about things like back pain, a sprained wrist, neck issues, all super common. You might go see a chiropractor, and they determine you need an x-ray. Makes sense. But in BC, they can't order a publicly funded one. So you have to go get another appointment with a family doctor for the one and only reason of getting that referral slip.
Let's make this really concrete. Let's follow a patient, we'll call her Jane, who has a simple sprained ankle, and see the frustrating journey she has to take through our current system.
Okay, just look at this ridiculous pathway. You sprain your ankle, a chiro says, yep, you need an x-ray. But for the province to pay for it, you hit a wall. So now you have two terrible choices. Wait days, maybe even weeks to see a family doctor, if you're lucky enough to even have one, or you go sit for hours in a packed ER. All of that for a simple piece of paper. It's inefficient, it's frustrating, and it's totally avoidable.
So what's the fix? Well, the proposal we're looking at is being framed as something pretty simple, an easy win.
And here it is. It's a formal proposal to give chiropractors what's called direct referral authority. All that means is letting them send patients directly for publicly funded imaging like x-rays. This isn't some wild new idea. It's just about letting trained professionals use their skills to clear that bottleneck we keep talking about.
And the goal here is crystal clear. This isn't just about convenience. According to the proposal, it's about making the whole process smoother for patients, cutting waste, saving money, and, this is a big one, freeing up our swamped family doctors to deal with more complex cases.
Now, a really key part of this whole argument is that BC wouldn't be venturing into the unknown here. Not at all. Other provinces have already done this, and they're already seeing the results.
Just take a look next door. In Alberta, they actually tried cutting this access, found out it was a huge mistake that just increased costs and delays, and so they brought it back, with support from doctors and the public. And then you have Ontario, where they estimate this change saves them somewhere between $15 and $23 million a year. The point is, this is a tested, proven policy.
Okay, let's talk about what this could actually mean for us here in British Columbia. Because when you look at the numbers, the potential impact is pretty eye-opening.
First up, capacity. Get this. This one single change could free up over 100,000 doctor's appointments every single year. Just think about that. For those 700,000 people looking for a doctor, that could be a game changer.
And of course, there's the money. By cutting out all those redundant doctor visits, the province could save an estimated $4.1 million a year. So it's not just better care, it's actually more efficient spending.
But for me, this is maybe the most important number of all, the impact on patients. A pilot study, done right here in BC's Comics Valley, found that direct referrals cut the wait time to start treatment by 23 days. That's over 3 weeks sooner.
And this chart just lays it out so clearly. That COMOC study? Under the current system, patients waited on average 33 days. With direct referrals, that dropped to just 10 days. That is a massive, massive difference in getting people the care they need when they need it.
So what do people in BC actually think about this? Well, according to an Ipsos poll, the support is overwhelming. A full 90% of people are in favor of this change. The public totally gets it.
So let's just pull it all together. The case seems pretty straightforward, right? This change frees up our doctors. It gets patients care weeks sooner. It saves the system millions of dollars. And it's already a proven success story in other parts of Canada.
Which brings us right back to our original question. You've got compelling data, you've got real-world results from other provinces, and you have massive public support. So it really makes you wonder, based on all the evidence laid out, why hasn't this change been made? Why isn't BC taking what really, truly looks like an easy win?